Hello guys, it's been a while since I last put up a video, so I decided to just share with you about one condition that a lot of patients come and see me for. And one of them is a cyst in a finger, like shown in this picture over here. This is what we call a mucous cyst. It's also some form of a ganglion cyst. It's a fluid-filled sac coming from the joint, which is also known as the DIPJ joint. Very common in elderly patients, usually because of arthritis, all right? And so, I usually tell patients that, if you were to type a lot on the computer, if you were to do a lot of housework, if you use your hands a lot, over time, your fingers will degenerate. And when you do an x-ray, you can see there's reduced joint space. It's because the bone is rubbing against the bone every time when you apply pressure on your hands. Then there will be reduction in joint space. And when the joint space is reduced, you start to get this extra outgrowth of bones called the osteophytes. And eventually, this can lead to cysts like this, called the mucous cyst. What do you do with it? Depends. So generally, treatment for hand osteoarthritis really requires conservative management first, obviously. Painkillers, activity modification, heat therapy. I usually tell patients to buy heat packs from local stores to actually put on your hand, especially in the morning. But generally, as you progress throughout the day, the pain and stiffness are generally better. Specifically for this mucous cyst, usually I counsel patients for a few options. One of them is just wait and watch. Try not to poke. Do not poke, actually, the cyst with a needle, because if you poke the cyst with a needle, you can get infection. And when you get infection, bad news, okay? So try not to poke it. It can resolve. It may come back. If it's persistently getting there, getting bigger, it's not getting better, you might want to consider surgery. And surgery, what do? We usually make an incision. We make an incision over here, raise up the skin, remove the cyst, and then push back the skin down. The aim is to drain the cyst and also clear out those arthritic bony spurs from the joint, as well as removing the inflamed synovium from the joint. This does not cure arthritis. It basically just merely a procedure to remove that lump and remove that bony outgrowth, but it can come back. All right, so there you go, mucous cyst in a nutshell.